Hey, good morning, Facebook. Greg Sommer, co-founder at Trak Fertility. I'm really pleased to be joined here at ASRM 2017 with Dr. Stan Honig.
Hi.
He is the Director of Men's Health at Yale University. Hey, thanks for joining us.
My
So
pleasure.
just a few questions. You know, we're here, big meeting, a lot of emphasis on male reproductive health. I have a few questions for you. So what would you say is maybe the biggest challenge facing men today in male reproductive health, and how can we, as an industry, as a field, help men do better?
Why? I just think it's important that men come in to see the doctor. Men between the ages of 18 and 40 tend not to see the doctor, and half the time it tends to be a male factor issue. And the sooner that you get in, the earlier we can find out if there's a problem that's either treatable or reversible.
Yeah, so it's that barrier to getting in and seeing the specialist early on.
Yeah, and I think that the important thing is that, number one, the patient comes in to make sure that there's nothing serious going on.
Right.
Number two, that there may be things that are treatable or reversible. Simple things like lifestyle issues, smoking, drinking, diet, things like that. And occasionally we'll pick up something that is easily fixable. We also want to make sure that patients make sure that there's nothing serious going on.
Right.
Most of the time, if there is something serious going on, that we can treat it.
Yeah.
So the earlier that you get in, the better.
Do you think men recognize that there is a tie, there is a link between reproductive health and your overall health or risk of disease?
You know, that's one of the things that we're just starting to look at. There seems to be evolving studies to show that if you have a low sperm count, or if you have a higher chance of being subfertile, that you might have a higher chance of having, let's say, a testicular cancer or prostate cancer, not now, but even down the line. Same thing is true with other health issues, cardiovascular risk, things like that. And that's something that that's in the news, and we're studying, especially in the light of the fact that, you know, the recent data suggesting that sperm counts may be declining.
Right. Yeah. You know, it's really a growing area, and a lot of data coming out really pretty quickly in that space. So lastly, do you recommend that men going through the fertility process at any stage take steps to improve their sperm quality? And if so, I guess how?
Well, I start off simple. I have a sheet that lists lifestyle issues and dietary supplements that can be used to help things. You know, the first thing is just to time intercourse with their partner appropriately. Not everyone knows the exact steps towards that, and if not, just go see a doctor. Make sure that there's, number one, nothing wrong, and two, that there are things that are treatable and reversible in male factor infertility.
Right. Yeah. And just a quick mention, you know, the Trak app is built for that reason. Help guys understand what they could be doing and some steps that could improve their sperm quality. Dr. Honig, thank you so much. This is a pleasure.
My pleasure.
All right. Thanks.
Take care.
Bye.